Hey guys, this is Frank at Naperville Acupuncture Center. Today we are going to share with you a corrective exercise for the gluteus medius known as the clam. So this is a pretty well-known exercise. It's very important for what is called your gluteus medius, okay? And this muscle is for hip stability. So this is a muscle which goes from your greater trochanter, which is the bony side of the hip here, to your iliac crest, okay, which is the higher part of the pelvis here. And when it contracts, it creates hip abduction, okay, so it lifts the leg sideways. However, in practical terms, we don't often make that movement unless we're doing martial arts or soccer or something like that. Most often, this muscle has a function of stabilizing, okay, stabilizing the pelvis as we're walking. So it's very important to walking, of course, but it's very important for treating back pain, hip pain, and knee pain, okay? So oftentimes when a patient comes here, they've got hip pain, back pain, knee pain, or sometimes even other things, foot pain, shoulder pain. We'll test the gluteus medius, okay? We'll test this muscle to see how well it responds to having pressure applied. And oftentimes what we'll see is that one side is going to be significantly weaker than the other, okay? So that doesn't mean that the muscle is weak in the sense that it's underdeveloped. It means that it has become inhibited, okay, inhibition. And that just means that, you know, it's got the power, you're just not able to access it. So what we want to do with our treatment, with our motor point acupuncture or our motor point stimulation is wake up the muscle, okay? We'll wake up this muscle. And then once it's been woken up, we treat it, we retest it, and oftentimes we can see the improvement in the function and the strength and even the pain. But we want to be able to keep this effect going. So to keep it going, we give a corrective exercise. And so the basic one is the clam. So to do the clam, what we're going to do is we're going to lay on the side like so, and a couple of cues here. You want your head and shoulder to be comfortable, so we don't want to just flop on the ground like this. If you want to use a pillow, you can. If you want to support it with your shoulder and wrist here, that's okay too, as long as you're comfortable. Second thing is the knees are going to be bent about 80 to 90 degrees, okay, so they're not pushed all the way back to the butt, they're not hanging out here, they're about 80 to 90 degrees flexed. Same thing at the waist here, we want about a 45 degree hip flexion, okay, so you don't need to be all the way up here. But one of the more important things is we want the hips to stack on top of each other, because when you do this exercise, the temptation is going to be to roll, okay, you're going to want to roll. And that is going to basically cheat the exercise, and it will make it easy to do, but you'll get a minimal benefit. So you want to make sure your hips are stacked up. And from here, once we've got our hips stacked up, we're going to make sure our core is intact, okay? We don't have to squeeze hard, but we want to just make sure the abdomen's drawn in and we're not collapsing through here. And then we're just going to lift the top knee towards the ceiling, and that's it. So that is the clam. So we want to make sure, and I even like to, with the bottom leg, push a little bit into the ground. So this is to strengthen the gluteus medius. It does pick up a little bit of the gluteus maximus as well, and the gluteus minimus. However, primarily it's for gluteus medius, okay? And again, this is important: back pain, sciatica, knee pain, so many things. And you could do about 10 to 15 repetitions. If that is too easy for you and you've been doing this for a while and you want to progress the exercise, there are several ways you could progress. So one way would be you could put a band, okay, around your knees to add resistance, and you could do the clam with some resistance. Now I don't have a band here, you'll have to visualize. Another progression is you could actually straighten the leg, okay, straighten the leg, and just lift up to the side, okay, keeping that hip in line. So this is an additional progression. There's another one which is a little more challenging kinesthetically. However, what you could do is you could lift the knee, keep the foot where it is, and then reverse. Let the foot come up and the knee come down. So knee goes up, foot comes down, knee goes down, foot comes up. And this one is a bit more challenging, as I said, kinesthetically as well as strength-wise.